Today we're going to measure knee flexion. Okay, very similar to a lot of our lower body range of motion tests. We're standing on the side of the client. Plenty of videos to go check out: hip flexion, straight leg raise, IR, ER measures. So if you haven't checked out, a lot of nuances that we go over in those videos. But today we're going to move a little bit further down the chain and look at the knee. We're going to look at it in absolute measure first. Okay, see how much knee flexion we have. Then we're going to break down a few nuances and when you measure, so when you influence tibial IR, ER, does that change knee flexion? Because we have to remember the screw home mechanism and the normal occurrence of IR during flexion in order to achieve the end range. So what we'll do to start, okay, just to get a gross idea of what we're looking at, I don't want to come all the way up to 90 degrees, okay? Come right around 45, 60 degrees. I keep my arm underneath her knee just to support it. And at first, I'm just kind of easing into it, see how far we can go. And then once I feel like I've got a good position, I'll push down, okay? Pay attention to any symptoms. Alex here has had quite a few injuries on this left knee, so we'll be careful here. And so roughly, I start to feel some end field there. So this is where I put the foot down. I'd get out a goniometer if I had one. I'd measure this angle here from the tibia through the femur. I could also use my oculometer, take a rough estimate. It's about 100, 125 degrees. Now what we can also do is understand there's any sort of rotational influences to this, which is very normal. A lot of people have some sort of IR, ER bias at their knee that's going to influence how much flexion they have or how much extension they have. So remember, normal mechanics of the screw home mechanism. As I extend my knee out, okay, as I extend this knee out in the open chain, there has to be some level of external rotation moment to lock out that knee. So the opposite is true when I come down. There has to be some sort of IR, okay, notice how I'm taking the hand to guide the tibia into IR to get a little bit more flexion. Now this is one way we can do that, where I'm just taking the foot and the lower shank and really driving internal rotation by putting force through the distal tibia to turn it in. And if I can pick up more IR, then that tells me she's biased towards ER, okay? If they're a long limb, big bone body like the NBA players I work with, sometimes what I have to do is get them to their end range first, and then I'll sit down next to them, almost like a Lockman's test. But what I'll do is I'll take my hands, make like a big U, and I'm gonna come from the back side and really just rotate into either ER or IR, and then same thing. Notice how, okay, I'm really taking out the slack, driving this tibia into IR, and then the same thing, I'll try and push a little bit more to see what I get. So by influencing those IR, ER measures, it gives us insights as to what the whole limb is doing. So two things you can do to start. One is just look at it grossly. Okay, how much knee flexion do they have? And then to a little bit more nuance about tibia, IR, and ER, you can either bias an IR through here if they have a small enough limb. Okay, can I pick up more flexion? Almost like a Slocum test, right? You kind of measure to assess meniscus. Okay, I'd come down, all right? Add the IR component, or if they're a big boned individual, larger limb, you can really kind of grab your hands around the proximal tibia, rotate in, and then flex up again. And those are a few ways that you can look at how to measure knee flexion with influences of tibial IR.